Are you a nursing mom wondering if it's safe to take Robitussin? In this video, I'm going to discuss the safety of taking Robitussin while breastfeeding and share some tips on how to use it safely. 1. The safety of Robitussin for nursing mothers. Robitussin is a cough suppressant and expectorant that works to reduce coughing, chest congestion, and other cold symptoms. It's available both over-the-counter OTC and by prescription. When taken in small doses as directed on the product label, Robitussin can generally be considered safe for breastfeeding mothers. However, it is important to speak with your healthcare provider first before taking this medication while breastfeeding. This is because there have been some studies that indicate that Robitussin may pass into breast milk in small amounts and could possibly affect the baby's development or cause side effects such as diarrhea or vomiting. 2. Guidelines for taking Robitussin while breastfeeding. Robitussin can be used safely while breastfeeding. However, you should follow the guidelines as specified by your doctor or pharmacist when taking Robitussin while nursing. When taken as directed, it is generally considered safe for a breastfeeding mother and her baby. The American Academy of Pediatrics (AAP) recommends that mothers avoid medications such as Robitussin if possible during the first 2 to 3 weeks after delivery when the baby's liver is still maturing and not able to process drugs effectively. During this time, natural remedies such as drinking warm fluids and using a cool mist humidifier can help relieve congestion without having to take additional medications. 3. Potential side effects of Robitussin on a nursing baby. While Robitussin is generally considered safe for breastfeeding mothers, there are potential side effects that may occur in their nursing baby. Most of these side effects will be mild and easily treatable, but they should still be monitored and reported to a doctor. The most common side effects seen in nursing babies include increased drowsiness, irritability, stomach upset, and diarrhea. If the mother notices any of these symptoms in her baby after taking Robitussin, she should contact her doctor right away. The doctor may want to adjust the dosage or switch to an alternative medication if necessary. In rare cases, more severe reactions, such as breathing difficulties or allergic reactions, can also occur when a nursing baby is exposed to Robitussin. If the mother notices any signs of an allergic reaction in her baby, such as a rash, hives, swelling of the face or mouth, or difficulty breathing, she should seek immediate medical attention. Finally, it is important for nursing mothers to be aware that Robitussin can potentially pass through their breast milk to their babies. This could lead to an overdose in the baby if too much medication is consumed. 4. Possible interactions between Robitussin and lactation hormones. Another concern for nursing mothers considering taking Robitussin is the potential interaction with hormones produced during lactation. Although there has been no research to confirm any interactions between Robitussin and these hormones, it is still wise to be cautious when taking any medication while breastfeeding. The most common interaction that may occur is decreasing milk production due to the dosing schedule of Robitussin or its active ingredients causing a decrease in prolactin levels. Prolactin is responsible for stimulating an increase in breast milk supply, and decreased levels have been known to reduce milk production. Another potential interaction could involve Robitussin's active ingredient guaifenesin impacting thyroid hormone levels, which can further impair milk production. 5. Strategies for maximizing the benefits of Robitussin while avoiding drug residue in breast milk. Robitussin can be taken safely by nursing mothers if certain precautions are taken. To maximize the benefit of Robitussin while avoiding drug residue in breast milk, it is important to consider the following strategies. 1. Take Robitussin as recommended by your doctor or pharmacist. Generally, a single dose of up to 10 milligrams per day is enough to relieve cold symptoms and reduce coughing. Taking higher doses than this may increase the risk of drug residue in breast milk and should be avoided. 2. Consider waiting until after you have nursed your baby before taking Robitussin so that any potential drug residues will not affect your infant's health. If you're unable to wait, it is important to note that Robitussin has a relatively short half-life, and drug residue in breast milk should not be present more than 24 hours after taking the medication. 3. Consider using other safe alternatives such as saline nasal drops, steam inhalation, or over-the-counter cough suppressants like dextromethorphan if possible, before resorting to Robitussin for relief of cold symptoms. 4. Opt for the shortest-acting version of Robitussin available on the market. This will help minimize any potential drug residues in breast milk and reduce the risk of side effects in your baby. 6. Recommended dosage of Robitussin when nursing. If a nursing mother decides to take Robitussin, it is important that she follows the recommendations for dosage. Overdosing can cause serious side effects in both the mother and baby. The recommended dosage of Robitussin for nursing mothers is 10 mg/mg every 4 to 6 hours as needed. It is also important to note that many products containing Robitussin contain additional ingredients such as antihistamines, decongestants, or expectorants, which may not be safe for the baby. Before taking any medication containing these additional ingredients while breastfeeding, it is important to consult with your doctor or pharmacist. Additionally, if symptoms persist after 2 days of treatment with Robitussin, it is essential to consult with a doctor. It is also important to make sure that any other medications or supplements being taken do not interact with Robitussin in an adverse way. 7. Advice for mothers considering taking Robitussin while nursing. If you're a mother considering taking Robitussin while nursing, it is important to talk with your doctor or pharmacist before doing so. Your doctor may recommend alternative treatments that do not involve medication, or they may advise you against taking Robitussin altogether. You should also discuss any potential risks associated with the medicine and weigh them against the benefits of treating your symptoms. Additionally, if you decide to take Robitussin while nursing, be sure to take the smallest dose possible for the shortest amount of time. Taking less of the medication will help limit exposure to breast milk and reduce risk of possible side effects on your baby. In conclusion, Robitussin is generally safe for nursing moms to take as long as they are taking the correct dosage. However, it's always important to speak with your doctor before starting any new medication while breastfeeding. We hope this video was helpful in answering your questions about whether or not nursing mothers can safely consume Robitussin. Be sure to leave a comment below and subscribe if you found this information useful. Thanks for watching, and we'll see you next time.